Jess, maybe can we flip over to you if there was, okay, so we've decided maybe the big message for dietary guidelines was processed foods. Was there a big message on alcohol or what was the message on alcohol? I'm hoping you'll tell me what the message
The
was.
message on alcohol was pretty limited. It was basically drink less, which I mean I can't disagree with that, right? Like I can't say, that that's wrong. I don't think it is. And it was very the guidelines didn't have a lot actually on alcohol. It was pretty much drink less overall, everybody. And if you have these certain conditions, and those conditions largely did not change from the 2020 to 2025 guidelines, if you have certain conditions, if you're pregnant, if you have certain, medical conditions or a history of alcohol use disorder addiction in your family, you probably shouldn't drink. I would have loved to have seen more there on obviously liver disease. And, if you have medical conditions directly linked to or a susceptibility that's directly linked to alcohol, like liver disease or cancers, et cetera, the link between alcohol and cancer is very clear, even at, very low levels. Though as you get to lower levels of alcohol use in the large studies, the certainty does get a little bit worse, right? As in terms of its association between some of these different healthcare outcomes. So I think the overall message was drink less, but what was removed in the interval were specific amounts. So previously it was, moderate drinking or safe drinking with these caveats was, no more than one drink a day for women, no more than two drinks a day for men. And I think many in the alcohol research field, many of us who follow this, um, started to feel like maybe that was too high also. I think, like 14 drinks is actually a lot, so it really, I think the trend overall in much of the literature and in other guidelines around the world, including World Health Organization guidelines, was to move towards recommending less and less and really saying like even one drink a day is associated with these, poor health outcomes. There are associations between cancer risk. Again, that's probably the strongest that we see in the literature, and even these really small levels of alcohol consumption. So I can't argue with the recommendation to drink less. I think that's a good recommendation. But when I read these guidelines, what really jumped to mind was like this is kind of a starting point for people, and that a broader discussion with one's physician or one's medical provider really needs to happen to find out, okay, so I drink, 5 drinks a day. Drinking 4 drinks a day is better. Like I'm not going to say it's not, but really the recommendation should be, yeah, you really got to cut it down, even more than that. We do this a lot in our ALD, clinic and so forth, as I'm sure you do, Nancy and Kim as well, in terms of, where are people in their willingness and motivation to stop drinking when, they're given that kind of information about the health risks, assessing what matters to them. Like, does it, what aspects of your health matter to you? Is this affecting your relationships? Is this affecting other things? Like what, where are you at on the alcohol use disorder spectrum? Very different from alcohol quantity frequency measures, which are just how much and how often are you drinking? The alcohol use disorder is like, how is this impacting my life in these various ways? And so then that can be kind of a jumping off point for, okay, I should drink less, like how much less, and in my liver clinic, as I'm sure you do as well, my message to people that I feel sort of obligated and ethically bound to give them based on the data in the liver disease world is that there is no safe level of alcohol use that I can recommend. I can't tell you that it's fine for you to have 1 drink a day, half a drink a day, because that's not what the available data says. It actually says probably not, that you should not do, any alcohol. And so then we have a conversation about, if you are drinking more, what does drinking less look like and how can we get you down? If that's a goal for you to abstain, how can we get you down to that? Yeah. So very much just, I was like, oh, this is like a jumping off point for a conversation. This is not, I did not view this as like a comprehensive, at least as it's presented to the general
Yeah.
public in those graphics. This is very much, in my mind, not a comprehensive, like discussion of this. It's like, okay, take this to your doctor and talk about it, because like, how much is a drink? That's not in there, right? It's
Yeah.
nobody knows. that routinely is misestimated by physicians and patients, and everyone about what one drink is. What's the difference for men versus women, right? The sex-based differences were removed from the recommendations. And again, those are very clear, very physiologically based, and lots of, evidence that women process alcohol very differently, and that we do have higher blood alcohol concentrations with the same amount of drinking. In the liver disease world, again, multiple meta-analyses have shown an association between drinking and liver disease that is greater for women than for men at similar levels of alcohol consumption. So none of that was in kind of the basic, offering to the general public.
I would have liked for them to have included a gastric bypass patient as someone who should not drink.
Yeah.
I mean,
Yes.
anything beyond just pregnancy. Most of us know that fetal alcohol syndrome is a bad thing to give to your child. But there are other increasingly prevalent conditions like gastric bypass where alcohol is not safe at all.
Yeah, absolutely. Yeah. Or just something about like, if you have the following medical conditions, or susceptibility to these medical conditions, you should really consider not drinking at all.